Good evening. I'm Dr. Fred Rouse, and it's currently about 7 o'clock actually on Thursday. Where are we at here? The July 8th. I'm the Real Money Doctor, and I want to do today's daily recap of events that affect the way you get, protect, and enjoy your money, your life, and your retirement. Now, the question for today is, what happened to the Great Reopening? And we're going to get to that in just a few minutes. But we start every day, again, since I've been doing this for early in March or so, as to the current number of COVID cases, because COVID situation is the single thing that is affecting more people in this country than anything else right now. The single biggest thing is affecting almost everybody and everything that they do, every aspect of their life has been taken over by the COVID situation in some way, shape, or form. So right now, the current number of COVID cases is over 3 million cases right now, 3,088,000, okay, almost 89,000, 3 million, almost 89,000 cases. It hit 3 million yesterday for the first time, again, since January. So we're not bringing in the second half of the year really, really well at all. And that's an extra 53,000 cases overnight, an extra 53,000 cases. Now, of the total number of cases, 31% have actually recovered, which is not thrilling all by itself. It should be a higher recovery, but it's not. Okay, so of those 3 million cases, only 31% have actually recovered. Of those 3 million cases, 4.3% have actually died. So this is not a little thing that people keep blowing off. And that was a big thing for a while. Oh, it's no different than the flu. And you still have people denying this whole situation. I think it's a big hoax. However, okay, talk to the 4.3% of the people that have died from this so far. And that total number is 133,000. 133,000 people have died so far from COVID. Now, you can slice and dice it any way you want. Say that it's being overreported or it's not being overreported. It's probably actually being underreported in all reality. But you still have a lot of people dying from something. This situation has affected everyone in some way, shape, or form. That's not going to go away anytime soon. Now, New York has the first highest number of cases right now in the United States. They come in at 398,000 cases. That's another 692 since yesterday. So they're sort of under control, sort of. Okay, their deaths in New York State are at 32,251. So that's just a little bit more than yesterday. So they're moving along, and they've got control over this thing pretty much. California's taking the number 2 highest spot with 292,000, almost 293,000 diagnosed cases. 8,000 cases more than yesterday. 8,000 cases more than yesterday. They have 6,749 people have died in California from COVID. That's another 172 since yesterday. 172 people have died in California since yesterday. Florida has the number 3 spot. Again, they went up this week. Texas, number 4. New Jersey's dropped to number 5. Illinois is number 6. Massachusetts is number 7. Arizona has moved up to number 8 this week. Georgia has moved up to number 9. And Pennsylvania has dropped down to number 10. Now, it's Thursday. And every Thursday, the unemployment numbers come out. And they came out today. And right now, it's another 1.3 million U.S. workers have filed for unemployment insurance just in this last week. And that's according to the Department of Labor. Now, the jobless claims, they've sort of leveled off a little bit since peaking at basically 6.9 million in March, late March. And they still remain at historically level highs. Okay? And it's been right now in the millions for over 3 months. Over 3 months. Just another million cases every week for the last 3 months. Now, prior to COVID, okay, the record weekly unemployment filings was 695,000 back in 1982. Just to get some perspective on what's going on. 695,000 was the record in 1982. We had 3 months of a million cases a week. A million cases a week, people unemployed. Now, the list of data from the Department of Labor indicates that some businesses are reopening as the pandemic restrictions ease, but some 18 million people, 18 million workers, are still receiving unemployment insurance. Now, the extra federal unemployment insurance, that money that they've been getting before, that extra $600 a week, that's about to run out this month. Things are not going to be happy for those folks. Now, since the pandemic began, more than 45 million people have lost their jobs and filed for unemployment insurance. Now, new claims have dropped off for 14 straight weeks, despite the uneven nature of the COVID-19 restrictions and the outbreak itself, according to Bankrate's senior economic analyst, Mark Hamrick. Okay, and he said that today while he was talking about the jobless claims figures. So, even so, with more bankruptcies and job cuts announced in the retail sector, for example, the economy remains a significant risk in the weeks and months ahead. Now, the official unemployment labor rate in June was 11.1%, according to the Department of Labor last week. Economists, however, cautioned that this figure might not really encompass business reclosings that have happened in recent weeks amid the coronavirus, the cases surging basically in the last few weeks in a lot of states. As the COVID outbreak, recently intensified in some states, hopes for an accelerated and sustained successful reopening of the economy have hit some roadblocks, according to Hamrick. This raises concern about the economy's rebound. What a surprise. There is no V-shaped recovery. A U-shaped recovery would be novel at this point in time, and that's not going to happen too quickly either. You get people that have been laid off, have been furloughed. They find out that after a couple of weeks, that furloughed, they were anticipating coming back to work, their business actually shut down. And that's happening a lot. A lot of retail businesses are just shut down. They're going filing for bankruptcy, and those jobs are gone. And it's not a pretty picture. It's just not. Now, some of the hardest hit industries in the COVID situation are hospitality, retail, and food and beverage services, along with the travel sector, some of which have never really fully reopened and are still getting hit with new closures as COVID cases continue to spike. Now, that really brings me to the question for today is, what happened to the great U.S. reopening? Turns out it's really gone way off track. Basically, what we're seeing happening in New York, what we saw happening in New York back in March, except it's happening now in multiple metropolitan areas of the country, said Dr. Lena Wan, an ER physician and public health professor at George Washington University. And we don't have the political will or the public willingness to impose new shutdowns as we did back in March. Now, there were consequences to reopening too soon. The first reported case of COVID-19 in the U.S. was back on January 21. By late April, more than 1 million Americans were already infected. At that time, states like Florida were already outlining reopening plans, even as New York was the major epicenter. And they had already counted more than 22,000 deaths and 300,000 cases. But Florida was still looking to open at that point in time. A couple weeks into June, there were 2 million more cases. On Wednesday, less than a month later, the country topped 3 million cases. This is just one day after reopening, the highest single tally so far with 60,000 cases. More than 90% of the U.S. population was under some type of stay-at-home order in the early spring as just the sheer number of cases brought the healthcare system in some states to the absolute brink. And you remember, New York State was crying for ventilators. They were terrorized. Governor Cuomo had no idea what was about to happen. He was crying out for ventilators all over the place because the numbers were that bad. Refrigerated trucks were backed up outside of hospitals because they couldn't hold the bodies in the morgues. But still, the Trump administration was eager to reopen the economy and get things started again. There were protests against the shelter-in-place orders, but erupted all over the place from Washington State to Western New York. And in late May, many states began actually lifting restrictions despite their warnings. That expanded testing and contact tracing were actually better options, and they need to be really enforced a whole lot more. Now, most of the country is now living the consequences of reopening too soon and of a failure to have adequate national COVID strategy and response in place. Now, the American people have made tremendous sacrifices to get us to where we are. That's according to Baltimore's former health commissioner. Tens of millions of people have lost their jobs. Kids were out of school and lost valuable time. And unfortunately, we're in this position where it happens that we squandered all that time, and that these sacrifices that were supposed to be made by us were just wasted. Today, 33 states are trending upward in average daily cases, an increase of at least 10% over a previous week. Many states are pausing or actually rolling back their reopening plans. Those that account for more than 40% of the U.S. population have already put their reopenings on hold, according to Goldman Sachs. Now, states with the other 30% of the population have actually already reversed parts of their plan. The administration has largely left reopening plans to the states. And again, the president just fluffed this off completely. He won't take no responsibility for anything. And he said the states were on their own to get their own supplies. He wasn't a clerk. He wasn't a shipping clerk. So the states went crazy and they did their own thing. And it's been a patchwork ever since. Now, CNN, their medical analyst, Dr. Celine Grauder, an infectious disease specialist and epidemiologist, said many states took half-hearted steps to combat the spread of the virus. Stricter shelter-in-place orders could have been implemented much earlier than March and April. If we had all locked down simultaneously and had taken that 2-month period to do what we actually needed to do with preparing and meeting the gating criteria for reopening, and then all of them lifted slowly, we'd actually be in a much better place and a different position than we are right now. Now, there is still a very, very piecemeal approach to opening and mixed messaging that just adds to the mess right now. Even the Texas governor, Greg Abbott, said that I reopened the bars too soon. Now, countries like South Korea and Germany and Taiwan succeeded with slowing the spread of the virus with steps that included moving quickly to monitor those that were quarantined and conducting widespread testing and tracing. These are critical steps. Other countries have been able to combat this because they had a national coordinated strategy. Instead of this piecemeal approach combined with mixed messaging and even actual disdain for science and public health that some of our public officials have exhibited. Now, we really didn't need to be in this position. We really didn't need to be at all. In Florida, health officials already reported on Thursday 8,900 new cases of COVID and at least 120 deaths. Nearly 50 hospitals in that state have had their intensive care units at full capacity. Florida, California, Arizona, and Texas account for about 50% of all the new infections. On Wednesday, Texas set its record highest single-day fatality that increased with 98% dead in that state. The same day, it reported the second highest daily count of new cases at 997,000. Louisiana, despite progress in recent weeks, has mounting levels of community spread, forcing New Orleans to limit bars and restaurants to 25 patrons inside and prohibit bar seating completely. Arizona has led the nation more than a month, with the highest 7-day average of new coronavirus cases per 100,000 people, according to data from Johns Hopkins University. Even California, who was really once praised for implementing early restrictions, has seen infection rates rise in Los Angeles to levels not seen since April. The nationwide spikes in cases come less than 3 months before the start of the flu season, which health experts warn could coincide with the new wave of COVID-19. Now, we could well face a double whammy come the fall, as what Dr. Wen had said. You'll end up seeing many patients coming in with the same type of symptoms and fever, shortness of breath, and coughs that will really exhaust our supplies of PPE, because the patients who come in, you don't know what they have. So you don't know how to treat them just yet. And you have to treat them as though they had COVID. And it will be a major, huge strain on healthcare systems for beds, ventilators, and more importantly, for our healthcare workers. The healthcare system is going to be overwhelmed with COVID in most of the country this fall and this winter, according to Growler. Now, Dr. Anthony Fauci, the nation's leading infectious disease expert, and others already said that there's still time to turn the tide in this pandemic across parts of the South and the Southwest. But states need to start pausing their reopening and expanding their testing and the tracing and encouraging physical distancing and wearing masks. And there's still a major, major dispute going on with the masks. I don't understand how it has gotten so political just to wear a mask. You get red hats and blue hats, and they're on both sides of the thing, and nobody's meeting in the middle for this thing. Now, according to Fauci, he said, I would hope we don't have to resort to a shutdown. He said that Thursday. Now, I think that would be something that was obviously extreme, and I think that would not be viewed very favorably. So rather than think in terms of reverting back down to a complete shutdown, I think we should really need to get the states to just pause their reopening process. That's according to Fauci. Now, what's it really all mean to you? Now, the president made a push to reopen the economy months ago. Those who embraced his thoughts and started reopening are now in the midst of their biggest surge in COVID cases and hospital admissions. Now, the president is making a new push to reopen the schools, and he's already retweeted originally that he will withhold federal funding for those that don't reopen with full in-person classes. Now, the other day, the CDC issued guidelines on how to reopen schools. Shortly afterwards, President Trump and his administration and the officials said the CDC guidelines were too restrictive, and he was going to talk to them. Yesterday, Vice President Pence said the CDC would be reissuing new guidelines that were less restrictive. Now, you have to understand, the original guidelines that they issued were basically the same guidelines that were used in Germany and the Scandinavian countries that have all reopened their schools. Also of note is that all these other countries, they already had COVID spread considerably more under control than here in the US before they even started reopening their schools. In a surprise move today, the CDC said they're staying with their original guidelines, and they would only make changes based on new science. That was sort of interesting. It's a little bit of a pushback. Now, the situation is an absolute mess. There is no consistent federal message, not based on science anyway. There's no federal leadership. There's no federal coordination. The testing is still not available where it's actually needed. States are still lining up for hours and hours and hours trying to get tests. You could be waiting for close to a week if you were lucky to get a test to get the results back. There are still shortages of PPE, and it's having its effect on patient care. We talked about this yesterday. Lots of primary care physicians' offices just can't open up. Dentists can't open up. They don't have the PPE to take care of their patients. People are suffering because they don't have supplies. Now, do you remotely think, just remotely think, that a push to reopen the schools is going to have any better result than the push to open our economy? No matter what you think about the president, about the COVID situation, about masks, reopening or not reopening, there is something really, really basic going on that does affect you. If you're 50 plus, at some point in time, the chances are you're going to want to retire from working a full-time job or running a business. Just a few years before you make that decision, you're going to realize that everything you've been told about saving for retirement that hasn't worked for you, okay, it's been a disaster. The idea, the 30-year plan of saving $800 to $1,000 a month, buying mutual funds and stocks and annuities that was supposed to grow to 1.5 million by the time you're hit 65, that hasn't worked for you for a string of reasons that have happened over the last 20 to 30 years of your life. And that was all before COVID. Now, here we are, first 6 months of the year, and you've been financially impacted. Most everyone has. Okay? In one way or another, COVID has made major impacts on everybody's finances. However, the clock keeps ticking. And every day we get a day older. And if you're 50 plus, you already know that you don't want to be doing this stuff forever. You also know that what you've been doing up to this point has not made you 100% certain that you're ready for your eventual retirement. That was before COVID. Right now, after 6 months of this, you're pretty certain you're not ready at all. No. You don't want a lot, though. You're not really asking for a lot. Okay. Most of my clients and students don't ask for a lot. Okay. They're not the top 1% of the country that's got all the money. They're just the working class folks. That's where I came from. My dad was a carpet layer in South Philadelphia. He had 4 kids. We had 2 pairs of shoes, school shoes and play shoes. When the school shoes are tired, they're your play shoes now. So I didn't come from money. He didn't have any money. He was pretty much paycheck to paycheck. So I know what it's like. My clients for the last 30, 40 years when I was actually working, they were working class folks. And none of these people really wanted a lot. They just a certain level of respect for what they did and what they've already accomplished in their lives. Okay. All they wanted to do was be able to take care of their friends and their families and be able to retire with some dignity and not have to worry that they were going to run out of money 10 to 15 years before they actually died. So is that actually still possible? It really is. But it's up to each and every one of us to make a decision on how it's going to work for us. Now, we can change the eventual outcome by changing the decisions we make today and the action we take today and consistently take in the foreseeable future. Now, if what you've done so far in your life has gotten you where you are, and you're not happy with where you are right now, then do you think maybe you might want to do something a little bit different? If you do something different today, chances are you can change your tomorrow. Think about that. You can change your tomorrow by doing something different today. The 30-year plan thing hasn't worked for you. You don't have time for it at this point in time. So what do? I'm Dr. Fred Rouse. I'm the real money doctor. My only goal is to help you get, protect, and enjoy your money, your life, and your retirement. I'd like to help you to get control of your life and your money. I'd like to help you make that better decision today and give you a path that you can follow so you have a better tomorrow. The one thing that will allow you to do that will always have the option to retire in the next 3 to 5 years with the cash flow that you'll want and need to maintain the lifestyle that you want and deserve without ever having to worry about a job again or money again, is something that I've come up with. Go to my site, drrousenow.com. On there, I've got a 12-minute video. Take a peek at it. See if it makes sense to you. If it does, schedule a call and we can chat. I can't guarantee you anything. Again, I'm retired. My only thing here is I want to help you get, protect, and enjoy your money, your life, and your retirement. This is what I do in my retirement. Okay. I've got enough money. I'm doing just fine. Okay. And now's my opportunity to give back a little bit. And this is what I do. Now, there's only one of me. Okay? I'm not trying to build some multi-million-dollar organization. I'm not that interested. I enjoy spending time with my wife, Dr. Terry, and we have a good time. So go to the site, drrousenow.com. Take a look at the video. It explains the program. If it makes sense to you, schedule a call and we can chat. You can't buy anything on the call. I do the calls myself. It's not a call center from India, not one of my team members. It's me making the call. I do that for a very, very specific reason. I want to know, one, do you have a need or not? Two, can I actually help you or not? And three, do I think that we can mutually work together? All three of those things have to line up. Now, some people don't like me. That's okay. Okay. I get some nasty comments every now and then on the Facebook feed, some nasty comments on the YouTube things. Some people don't like that. I think everybody should be wearing a mask. That's okay. They're not here. They're not my clients. Life is that simple. I can't help everybody. I'm not trying to help everybody. But if you like what I've said and you think I can help you, watch the video, schedule a call, and we can at least chat. For now, I'm pretty much finished the show for the evening. I appreciate you spending some time with me. Like and share the video. I'll be posting this video on my YouTube channel, The Real Money Doctor, tomorrow. Like and share it there. Make sure you comment. And again, I look forward to seeing you tomorrow, probably around 7 o'clock if we get lucky. Thank you.